Is Women's Health Month, and it's a time to encourage women to prioritize their physical, mental, and emotional well-being. Joining us today is Dr. James Culver, MD, OB-GYN at Northern Light Women's Health in Ellsworth. We're going to be talking about hormone replacement therapy and how it can help those who are going through menopause. So Dr. Culver, thank you so much for joining us today. So let's talk about hormone replacement therapy, and we'll start simple. Kind of what is it?
Yes. Well, thanks again for having me. It's great to talk about this topic. And, first, I think just to make sure everybody's on the same page in terms of what menopause is, menopause is that transition time in a woman's life where her hormone levels are starting to decline and will eventually stop. Specifically, we're talking about mostly estrogen. And most women are going to have a lot of symptoms associated with that, sometimes before menopause, during menopause, and then after menopause, the postmenopausal time. And hormone therapy is really designed to help women with the symptoms that they're experiencing as they go through all of those transitions. So things like hot flashes, night sweats, difficulty sleeping, mood changes, vaginal dryness. They're obviously a very long list of symptoms I think a lot of women are very familiar with that hormone therapy can hopefully help them with.
So what are the types of therapy?
So there are several different types. First, we talk about systemic hormone therapy, and that's really for somebody who's having symptoms all over their entire body. So the hot flashes, the night sweats, the difficulty sleeping, the mood swings, those need systemic therapy. And that's something that they're going to take either by pill, sometimes by a patch, a vaginal ring, their gels, different ways to get that therapy started. Then there are also localized therapies. So someone might just be experiencing problems with vaginal dryness, and especially with intercourse, and the localized estrogen therapies are going to help with those treatments. Also then, therapies are either combined, they are two hormones, estrogen and progesterone, or they may just be estrogen. And which one a woman needs is relates specifically to their own history and something they would review with their provider.
And let's talk a little bit about some of the risks. Are there any risks associated with hormone therapy?
Well, unfortunately, yes. I mean, I think that it's very important for patients to, evaluate the benefits too, and with their provider, try to determine how that all balances out for them. But there are risks. There are risks of blood clots in a woman's leg, something called a deep vein thrombosis. We worry about risks of strokes with estrogen. Most people are familiar with the possible increased risk in breast cancer that can come with hormone replacement therapy. And those are just to name a few. But again, I think you have to balance that against the quality of life that a patient is experiencing without those hormones, and what the right balance is for them is something that they can certainly explore with the provider.
And jumping off of that, who should consider starting hormone therapy?
So I think most women go through that menopause transition with some symptoms, and some they might be mild enough that they don't feel like they need therapy. I think for most women, though, those symptoms do affect their quality of life. And if they have what we call moderate to severe symptoms, so hot flashes that are really making it hard to work or concentrate at work, or difficulty with vaginal dryness and they cannot be sexually active because of that, those are considered moderate to severe symptoms. Certainly something that I think a patient should consider starting therapy.
And what about, how fast do the results work? So if you start hormone replacement therapy, how quickly do you feel better?
Yeah, well, fortunately, pretty quickly. I mean, I tell my patients to expect to see some improvements probably within a couple weeks, but I ask them to wait 4 weeks before we really know where they are in terms of how well the treatment's working. And so, at 4 weeks, if it doesn't seem like the right amount, we can make dose adjustments for them. So it's important to have a good conversation back and forth with your provider to help work that out and make sure you're getting the appropriate treatment for that person.
All right, Dr. Culver, thank you so much for joining us. Very important topic. Glad we could spread some information out there to our viewers. And to learn more, you can go to northernlighthealth.org/women's health for more information. Dr. Culver, again, thank you.